So again, kindly type in the chat box your local organization and your country. So let's check. So while waiting for the participants to type in their um, current locations and of course their local organizations, again, we warmly welcome everyone to our first ever collaboration training with JCI Nagpur Fortune of JCI India and JCI Bacolod of JCI Philippines. So let me check. So we have here from JCI Calantiao. We also have from Nagpur, India, JCI Bacolod, and then we also have JCI Fortune. So for others, hopefully you can send also your location so that we would know where are you from for today's webinar. So wonderful. It's really inspiring to see leaders and members from different communities and countries gathered together in one virtual room. So may I see a heart reaction, a heart sign, or perhaps drop a heart emoji in the chat box if you are excited for today's session. All right. So thank you. I can already feel the enthusiasm and energy in the room. So before we formally proceed, we would like to acknowledge the leaders of our partner and participating local organizations for their support and collaboration. So we have our JCI 2026 president for India. We have JC Abhishek Tumsare from JCI Nagpur Fortune, JCI 2026 President. We also have our Masarig Presidents from our co-host chapters, JCI Aklan Kalantiao, Press Genesis Angelo Tan, in the presence of EVP SDD Marden Maige. And then we also have JCI Antique Cruhay with Press Lord Liomer Pomperada in the presence of EVP Manfred Evans Palcath. Then we also have JCI Mandaue with President Jess Anthony de la Cruz, JCI Rojas Makawiwile, Press Eliza May Capa, JCI Rojas Sinadia with Press Lester Vega, as well as to our co-host organization, Alpha Phi Omega Negros Island Region, represented by Regional Director Gideon Monti Alegre. So, of course, we also have our visiting chapters. So, we'll acknowledge everyone later. To all our officers, members, trainers, and guests for this afternoon, thank you so much for joining this webinar session. So your presence today is truly appreciated, and we are grateful for your support and active participation. So to formally open our program, may we request everyone to please focus your eyes or your attention on the screen for our Indian national anthem to be followed by the Philippine national anthem, JCI prayer, creed mission.
Thank you so much, Director. For Indian National Anthem, I request everyone to please listen to it and stand up from their places. Mic off.
विधाता जय हे जय हे जय 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 हे
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड
उत्तरंग
विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव
तव
शुभ नामे जागे तव शुभाशिष मागे गाहे तव जय गाथा जनगण मंगलदायक
मंगलदायक
जय
जय
हे
हे
भारत
भारत
भाग्य
भाग्य
विधाता
विधाता
जय हे
जय हे
जय
जय
हे
हे
जय
जय
हे
हे
जय 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 जय
जय
हे
हे
भारत माता की जय।
जय
स्टॉप शेअरिंग करतो स्टॉप शेअरिंग करतो
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, pero sa sinakalan, alam ng puso, sa titik mo'y buhay. Upang hinirang, tuyag ka ng magiting, sa mandulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit kong bagaw, ay hinatang tula, kawin sa pagkayang minamahal. Ang isang ng matawad mo'y nagumpay na naghihingi, ang bituin at araw niya kailan ang ay di magtitingin. Luma ng araw ng walhagin pagsinta, buhay langit sa piling ko. Ang inigaya na pagkay mga api, ang mamatay ng dahil sa'yo.
JCI values. We believe that faith in God gives meaning and purpose to human life, that the brotherhood of man transcends the sovereignty of nations, that economic justice can best be won by free men through free enterprise, that government should be of laws rather than of men, that Earth's great treasure lies in human personality, and that service to humanity is the best work of life. JCI Prayer. We reaffirm our conviction that faith in God gives meaning and purpose to human life. May the Lord guide us in all our undertakings. JCI Mission. To provide leadership development opportunities that empower young people to create positive change. JCI Vision. To be the foremost global network of young leaders.
All right. Now that we have formally opened our program, let us carry the values reflected in our creed, mission, and vision. So, throughout today's session, as a quick reminder, please observe the following guidelines. Again, rename using this format. So, position name, PH local organization if you are from the Philippines, and position name India local organization. Example, we have here Press Francia, PH JCI Bacolod. And for our house rules, always stay on mute when not speaking. Use the raise hand feature for questions. Wait to be acknowledged before speaking. And you may also have your snacks with you and drinks ready nearby and participate actively and enjoy the learning experience. So before we formally begin with our session, I'd like to ask everyone, how are you feeling today? So with that, kindly use any emoji in the Zoom to indicate how are you today. So we have our Zoom emojis there. Ayun, may thumbs up from the ASDD. How about the others? We have heart, reaction, thumbs up. Are there other emojis that would tell us how do you feel this afternoon? All right, ayun, from G's. We have also from Bavish, Dr. Vito, ayun. And then also a blue heart from Press Manfred. All right. So hopefully you are all excited to begin with our session this afternoon. Now that we're all settled rather, let's officially begin today's training session. To formally welcome us and set the tone for this afternoon's program, it is my honor to call on the 2026 Vice President for International Opportunities of JCI Nagpur Fortune. Let us call on JC Jigyasa Sheware, who will be delivering the welcome message on behalf of President Abhishek Tumsare. Ladies and gentlemen, let us welcome JC Jigsaya.
Thank you so much, Director. A very good afternoon to everyone. I, JC Jigyasa, Chairperson for today's JCI International Exchange event, and it is my absolute pleasure to welcome you all for today's JCI International Knowledge Exchange session. A very warm welcome to all our respected JCI leaders, distinguished trainers, esteemed speakers, fellow JCI members, and participants joining us today from India and Philippines. Today's program is much more than an opportunity to gain new knowledge. It is a platform to learn, grow, exchange ideas, strengthen our leadership skills, and build meaningful connection beyond boundaries. As JCA proudly believes in its mission of developing leaders for changing the world, I encourage everyone to actively participate throughout today's session. Feel free to engage and ask questions. Share your perspectives and make the most of this wonderful session. Learning becomes truly meaningful when we apply it, not only in our personal and professional lives, but also in creating positive impact within our communities. I would also like to extend my sincere appreciation to our distinguished speakers for gloriously sharing their valuable time, knowledge, and experiences with us. I am confident that today's session will be both insightful and inspiring for everyone present. With that, let us begin today's program with enthusiasm, an open mind, and a true spirit of fellowship and learning that defines JCI. Thank you, and I wish everyone a wonderful and enriching session. Thank you.
Thank you very much, JC Jigsaya, for that inspiring welcome message and for setting a positive tone for this afternoon's training. Your words remind us of the importance of collaboration, continuous learning, and building meaningful international connections. As we move forward with today's program, JC Jigsaya will also serve as the chairperson for this collaboration training session. Without further ado, it is my pleasure to invite her once again to formally introduce our first resource speaker. JC Jigsaya, the virtual floor is yours.
Thank you so much, sir. Ladies and gentlemen, it is my immense pleasure to introduce our esteemed first speaker, JFD Dr. Swati Sarda ma'am. Dr. Swati Sarda ma'am is a renowned consultant obstetrician and gynecologist and fertility specialist with over 16 years of experience. She is managing director of Shrida Hospital Nagpur, where she has dedicated her career to women's healthcare and infertility management. Apart from being an accomplished medical professional, she is an iconic national trainer of JCI India, an author and a passionate mentor. She has conducted 100 plus soft skill training program, delivered 300 plus women health awareness session, and I was a trainer at NetCon 2025 on the topic of relationships. Her remarkable JCI journey includes recognitions such as Outstanding National Coordinator 2023, Iconic National Trainer 2023, and Outstanding Participant, the Author 2025. She has also received prestigious awards, including the Gold Medal for Best Paper in Infertility 2019 and the NOGS Gold Medal. Dr. Swati firmly believes that empathy and passion are the pillars of becoming a good leader. Today, she will be enlightening us on the topic that impacts millions of women worldwide: women health, PCOS, and PMOS. So, ladies and gentlemen, please join me in extending a warm JCI welcome to our distinguished speaker, JFD Dr. Swati Sarda ma'am. Dr. Swati Sarda ma'am, the virtual stage is all yours.
Thank you so much, JC Jigyasa. Very happy noon to all of you. At the outset, let me put on record my sincere thanks to JCI Nagpur Fortune, JCI Bacolod for this wonderful opportunity to be with you all here and share on some very important problem, endocrinological problem or the gynecological problem, I must say, which women worldwide they are facing. So it's a great opportunity for me to be here amongst all of you. So let us begin and understand that a few things about what I'm going to speak about today. Am I allowed to share my screen here?
Yes, ma'am.
Is my screen visible, JC Jigyasa?
Yes, ma'am. Your screen is visible.
I'm clearly audible, right?
Yes, ma'am. Absolutely.
All right. So, my dear friends, first of all, let me understand how many in the room have heard the word PCOD. Let's keep this very quick and interactive because, yeah. So, let us understand, let me understand from all of you, how many of you have heard the word PCOD? All right. Can we have it in the chat box if you have heard about PCOD? All right. How about PCOS? How many of you know the word PCOS? You can put it in the chat box. Yes, for PCOS. All right. So PCOD, very few, but yes, PCOS. All right. That's wonderful. Okay. Okay. Super. No, it's a no. All right. JC Vaibhav. Okay, now, how many of you know that PCOS is now called as PMOS? We'll definitely understand what these terms are, why they are called so, and all the details regarding this. But let me know how many of you know that PCOS, which was earlier called as PCOD, is now called as PMOS. All right, there are a lot. Very nice. Wonderful, wonderful. Thank you so much. Yes, my dear friends, thank you. So, dear friends, the terminology PCOS, it was very well known earlier, and now the same term has been called as PMOS. And let us understand why exactly the name change. PCOS is something called as polycystic ovarian syndrome, and PMOS, polyendocrine metabolic ovarian syndrome. Why the name change has occurred, we'll know more about this. Anywhere you feel that you have not understood a particular term, you can put it into the chat box and we'll take it towards the end of this session. Now, let me begin by sharing that PCOS is a very, very common disease among the girls and so almost like if we speak about the prevalence in India, 1 in 5 women are having this problem. When we say women, or the PCOS term, when we say it is right from when the girl starts menstruating till the time she attains menopause. So that is a reproductive period. And in this reproductive period, if we speak, 1 in 5 women are having this problem of PMOS. And if we talk about Philippines, it is almost 1 in 10. And a lot of these, they remain undiagnosed, and most don't know what exactly PCOS is or what exactly the PMOS is. And that's why the awareness and the diagnosis is very important. So whenever I get an opportunity to speak about some endocrinological problem or some gynec problem related to women, then I definitely choose one of these, because this has come up as almost an epidemic throughout the globe. So that's why it is very important for us to understand what is PMOS. So earlier it was called as ovarian syndrome, like I said, but now it is called as polyendocrine metabolic. So PCOS, when we said, it was, if you can see here, this is the polycystic ovary. And while the doctors were treating earlier, we concentrated more on speaking about the cysts which are seen in the ovary. And now we speak about the whole endocrinological organs which are involved in this problem. And we actually cater to these, diagnose these, and then start our treatment depending upon what exactly the situation is like. So when I say this, it is basically PMOS reflects a whole body hormonal and metabolic disorder in which involves right from brain to pituitary insulin pathways. I don't want to make it very complicated for you all to understand why the medical terminology, but we will very quickly understand what all organs are involved in this. So now what happens exactly? See what happens in a girl who has started menstruating in the first year itself. The girls nowadays, they start menstruating at the age of 9 years, 11 years, 10 years. Once they start menstruating, what happens is the brain, it starts sending signals into the body from the pituitary gland. The hormones are secreted called as LH and FSH, which goes to the ovary, and then the ovary secretes the hormones like estrogen, progesterone, testosterone for the controlling of the whole cycle. Now, it is not only the menstrual cycle which is controlled by these hormones, but also it controls the other parts of the organs like bones, the cardiac health, the skin. And this is also that why important that we must keep this chain in a proper order. So in PMOS, what happens is all these organs which are involved, right from the brain to ovary, these, I mean, the pituitary gland which releases the hormones LH and FSH, secreted further by the ovary, there is the whole hormonal milieu is disturbed. And when this is disturbed, what happens exactly is these LH and FSH, the hormone LH, FSH, they increase in the body, and that's why this rhythm of the hormones which are. Now, what do they do? So let us understand by a very simple example. When we are suppose in a chatting, like we are in a room right now. So when I ask you a question, there is question. When I ask a second question, you answer to that second question. So it is in a rhythm. So we reply to how what the question is being asked. Similarly, in WhatsApp also, when we know we are in a continuous flow, we reply to what's been asked. But in body also similarly, what is asked for, if the body doesn't get what hormones are asked for, then there is the dysrhythm which follows. So the hormones which have to be secreted in a normal level at a certain time in a certain quantity, if that doesn't happen, then exactly what happens is a polyendocrine metabolic syndrome. So this normal ovary, if we speak, see, if this is a normal ovary, this is the uterus. Very quickly, I'll go through this. This is a uterus. These are the two fallopian tubes which are next to the uterus, and these are the ovaries. These ovaries, what they do, this is a single ovary, normal ovary, where it forms a single follicle. So what does a normal ovary does? It develops one follicle, the follicle ruptures, and that ruptured follicle is good enough to give a pregnancy. Now in PCOS or a PMOS ovary, what happens, or we called it as a polycystic ovary. See, there are many, 1, 2, 3, 4, many follicles, they start forming on the ovary. So that's why it is called as poly, many. And cyst means these are not something which is very dangerous. These are the immature follicles. Why immature? Because in a single ovary, when a egg or a follicle, it becomes of like say 18 millimeter, 20 millimeter, it increases to that size, then it ruptures. But in PCOS, what happens is these follicles, they somewhere restrict their growth to 11 millimeter, 12 millimeter, and they don't rupture. So when they don't rupture, they do not ovulate. Then do not ovulate means there is anovulation. Anovulation means either the pregnancy will not happen and the hormones which are to be secreted in a normal rhythm, that will not happen. So in PCO, what we get is a multiple small immature follicles, no dominant follicle, the egg release doesn't happen, means the ovulation doesn't happen, and there are absent periods. That is why in PMOS, we see such, this is on the sonography what we see. When the patient comes to us, what we see is this polycystic ovary. So these is poly, means there are many follicles on the ovary. I request you to kindly stay muted. So this is what is seen on a sonography. Yeah, thank you. So this is what we see on an ultrasonography. This is a polycystic ovary. These are the tiny follicles which we see here. And these follicles, somewhere they secrete the hormones which increase in the body. And that's why we get the polycystic ovary. This is what we see on an ultrasonography. Now, what exactly happens in this PMOS is varied symptoms. Like, it is not necessary that you will see the same symptom in every girl. That's why it is called as a syndrome. Syndrome means a collective of different symptoms. So in varied orders, it can be seen as irregular periods, infertility. These are the most common problems with which the patient comes to us. So irregular menses, sometimes the patient does not even get their menses until unless they take medicines. That is called as only with withdrawal, when they take the withdrawal medicines for withdrawal. Weight gain, again, is very important. Then hirsutism, meaning having unnecessary or excess hair growth on face or chin, which is called as hirsutism. Then mood disorders, sleep disorders. So these are the varied problems which are seen in PMOS. These are the symptoms which are seen. The most differentiating thing, while it was called as PCOS, and now when we say PMOS, is the insulin resistance. Now, through the different studies, it has been seen that insulin resistance, you understand diabetes. So similarly, in diabetes also there's insulin resistance. Similarly, even in PMOS, this condition happens. Almost the 70% of the women, they have insulin resistance. 70 to 75% of the women, they have this insulin. What exactly is insulin? Is the key that unlocks body cells to absorb glucose. So when we eat, when we consume glucose or we consume food, that time the insulin is secreted in the body. In PMOS, the lock is broken out, saying that the cells ignore insulin signals, so the pancreas produce more insulin. And high insulin, it triggers the ovaries to produce excess androgens. Androgens meaning testosterone, male-like hormones. So even in women or girls, male-like the hormones which is in the boys, which is called as testosterone, in some amount, even it's present in the women. But when there is excess secretion of these androgens, the excess secretion of this testosterone, at that time, this excess androgen, again, it will cause the hormonal imbalance. And the women or girl, she starts getting the symptoms like hirsutism, excess hair growth, male-like hair loss on the scalp. Then there is change of voice, acanthosis. There's a black line which is seen around the neck. So these are the few symptoms which are seen because of this excess androgens, means increased secretion of the hormones like males. So what does this do? Testosterone. So now the insulin has increased in the body, the testosterone will increase and it will delay the ovulation and sometimes no ovulation. And that's why the irregular periods, that's why the acne, that's why the hair loss. Now, when insulin levels stay high, the ovaries produce excess testosterone, triggering a cascade of hormonal disruptions. I hope I am clear till now that what happens exactly in PMOS is excess of hormones, which are also the LHFSH, the estrogen, and the androgen, like the male-like hormones. And all these together, they do they disturb the hormonal milieu of a particular girl's body, and that's why there are so many symptoms which occur. Which are the visible signs? I said that there's a visible dark line which we call as acanthosis. Acne, a lot of girls, they present with a lot of acne, which they keep on getting them. The eruption of acne is almost non-stop. Then there are hair changes on the face, like hirsutism, excess hair growth. These are few symptoms. Then what exactly are we supposed to do? There is a weight gain also, like obesity. Most common cause of the the patients who come to us, number one is irregular periods, number two is infertility, then is the weight gain. The girl or the women, they complain that they are gaining too much of weight. The fat tissue which is stored in the body, it has an active endocrine organ. It acts like that, and it also secretes the hormones, again adding to the disruption of the hormonal milieu. So that's why in PMOS there is weight gain. Because of the weight gain, because of the excess fat on the body, there is further disruption of the hormonal system and further worsening of the PMOS. So this is a vicious cycle. And this vicious cycle we can break with weight loss. Now, what more than the weight loss we must also look into this is, when I say that there is obesity in PMOS, now does that mean that a thin girl cannot get PCOS? No. There are two different types. Rather, there are different types of PMOS. But here, when I say that only obese will get, no, also the lean girl or a thin girl can get PMOS. And that is the lean PMOS and the obese PMOS. In lean girls, again, only the weight gain is not there, but other symptoms can be there, like say irregular periods, hirsutism, insulin resistance. All these symptoms can also be seen in a thin girl. So a girl, if she feels that she has irregular periods, she has too many acne, or too much of hair loss is there, and other problems similar to PMOS are there, but she has no weight gain, should not wait and say that, no, I do not have weight gain, so I may not have PMOS. She should check with her gynecologist whether she has PMOS or not. So, and what happens in obese, I already shared that because of the excess fat, the fat also converts in, releases these hormones, and these hormones further disrupt the hormonal system. Along with this, now what happens with so many things going on, there is also the mental health issues. Now the girl someone who is not getting her periods regularly, she has bloating, she has obesity, she has acne, she has hair loss, will definitely have a lot of mental problems also because of the stress, because of the anxiety, because of the inferiority complex. She will also have depression. And we have seen so many girls and women having this type of depression only because of this problem. And when we solved this PMOS problem, they came back to their normal mental health status. So when we are speaking about all these symptoms which are visible, irregular periods, something a girl will say and it is visible to her, or she knows about that. Something again with like obesity, acne is visible. So these symptoms are visible, but we cannot neglect the symptoms which are not visible. So as a gynecologist or as a physician, we must definitely remember that if these girls are coming with PMOS and also presenting with depression, anxiety, we also need to take care of this. We must do a proper counseling at this stage and make them aware that once their system is into normal, once their hormonal milieu comes back to their normal, or it sets in normally, then these symptoms will also further decrease. Fertility is a big issue. Like I said, that in PMOS, mostly, 70 to 80% of the times, there is an ovulation. Means the ovary, which has to release an egg and has to fertilize for a pregnancy, it doesn't happen. So when the egg doesn't release, there will be no pregnancy. So what is the treatment? And many a times it so happens that at young age, when you get diagnosed with PCOS or PMOS, you read about it and you feel that the fertility is not possible, and the wrong information is given into the society that with PMOS you cannot conceive, which is absolutely a big myth. I'm telling you, it is very much possible, and we have so many patients worldwide. Also, there are such beautiful treatment facilities available, the treatment options available for the fertility treatment in PMOS. So it is just not right for us to say that, if there's a PMOS, there is no ovulation, that means no girl or a lady, she cannot become pregnant. No, it doesn't happen like that. Definitely, the treatments are available. And once we target the lifestyle modification of a woman, then definitely they start ovulating on their own also. So sometimes the girls or the women, when they come to us with missed periods, many a times they are surprised. And when we ask them to get a pregnancy check done, they say that it is not possible for us to get pregnant because we have PMOS. Then we have to tell them that sometimes when you exercise a lot, when you put your lifestyle back into order, that time ovulation is possible, and a normal pregnancy or a normal conception is also So PMOS can definitely, a lady with PCOS or PMOS can definitely become pregnant. Is this myth we need to solve in the society. There's a big misconception about this, that they cannot conceive. What are the long-term complications? Now, see what happens. Now we are speaking about a condition where excess hormones are going to stay in your body for a very long time. And I said that this is not only responsible for the periods. There are other organs also which will be affected by this. So heart care is also taken by these hormones when they are normally. So the increased risk of heart disease, diabetes, fatty liver, high blood pressure, and if not treated on time, not to scare you all, but the conditions like cancer of the uterus, these conditions are also very much possible. So that's why it is very important for us to treat the PMOS in time. Many times it happens that the girls, they feel that, okay, what happens if I don't get my menses for 2 months, 3 months, 6 months, 7 months? So many times we get girls, they have started ovulating, they have started menstruating at the age of 9, 10. Then suddenly they don't get their menses after 2 to 3 years, and they don't get it for 2 to 3 years. They feel that it is normal. No, my dear friends. This problem is hitting very, very young girls also, and we must target the proper care at this time itself. We have to make them aware that lifestyle modification is the most important thing which will take care of their PMOS problem, and we need to treat them at early stage. So it is not that only when they come for the infertility treatment we treat. No. So to avoid this, all these long-term complications, we must treat them on time. How doctors diagnose is through your number one is they will listen to you, your history. What is what exactly your symptoms are? Like I said, that no, it is not necessary for a girl to present with all the symptoms together. She may not have irregular periods. She may not have acne, hirsutism, but they can have different symptoms, and that's why it is called as a syndrome. So yes, history taking, we listen to you, we ask you what exactly the problems are. Then is the physical examination. We check on the BMI, the weight, the waist ratio, the hip ratio, their measurements and their ratios. We check on that. We check on the hair growth patterns. And we do certain blood tests in which we do certain hormone tests. Ultrasonography is done, and we check for the insulin resistance. We check on your insulin levels and the OGTT, which is also called as oral glucose tolerance test. And we do these are certain tests which we also do, the thyroid, the prolactin. See, all these are hormones, and we need to check along with the PMOS, the patient are very likely to have a thyroid disorder also. So these are the certain tests which we do. I'm not going into too many details of this because we need to understand what exactly is going to prevent this PMOS. We need to prevent this, my dear friends. All I'm saying, we very much need to prevent this. So number one, the mainstay of the treatment anywhere you go is the lifestyle modification. And when I say lifestyle modification, it is proper exercise. We advise for at least 60 to 90 minutes every day, along with proper diet. When I say proper diet, I'll talk about it again in the further slide. Whenever you check on the protein plate, it has to be protein, the content of the protein has to be maximum, then the fiber like vegetables, salads, fruits, and then will be the carbohydrates. Sleep and stress, very, very important that we must be stress-free and we must get proper sleep. And of course, whenever is needed, the fertility or the treatment for PMOS, whatever the symptoms are. Suppose irregular periods are there, we give it for a while. But there is again a big misconception about the treatment part. They come to us and they say, "Hey, madam, do we have a course of 3 months, 6 months with which we can take that course and then get cure from this disease?" No, my dear friends. PMOS, once diagnosed, stays with us for lifetime. And there is no cure for this so far, but we can definitely prevent that. Just giving to we know that diabetes, we can control that through proper exercise, through proper diet, and sometimes we also need medication. Similarly, PMOS also, we have to sometimes take treatment, but majority will also depend upon the lifestyle modification. That's why, see, if this order, if you check, it is lifestyle first, meaning exercise, proper diet, proper sleep, no stress, and fourth comes the medicine. So patients feel that we will take the medicines and we will definitely be cured of this. No, first and foremost is the lifestyle modification. Any doctor you go, they will definitely tell you to do a proper exercise, take proper diet. But we forget that because that is not available in the medicine format. So they only remember the medicines given by the doctor. So do not do this. The lifestyle modification is a must. So when I share this PMOS split, you can see that we eat the protein first. Whatever we take in a plate, be it at breakfast, be it at lunch or at dinner, whichever meals you take, even whatever food you are taking in a plate, make sure that the protein content is the more than the fiber than the carbohydrate, whatever you take. So the protein content into the plate has to be the maximum, followed by the fiber. Now, what to reduce is a very important. When I enlist the food which we need to reduce, often the patient tell us, ma'am, then what do we eat? Because I tell them not to eat any junk food, not to eat any fried food, and not to eat sugary food. So when I tell them, then they are surprised. Ma'am, what exactly to eat? So what exactly to eat is this, the PMOS plate. The protein, whatever you eat cooked at home. Protein diet should be more, followed by fiber. And what you should avoid is all the sugary drinks, soft drink, juices. Acha, fruits, when you consume a fruit, okay? Do not take a fruit juice of it, because then there will be too much sugar in that juice. And whenever you want to consume the fruits, take a whole fruit, eat a whole fruit. And then, of course, the bakery, we ask them to avoid the cakes, the pastries, and the bread, and the ultra-processed food. Exercise is a must. You can go for low impact or the strength training or whatever form of exercise you want, you can go for that. Stress hormones, we need to decrease them, because stress is one of the most important factor for this PMOS, and we need to decrease. Meditation definitely will help. A good sleep will help, and we staying away from all these stresses will definitely help us reduce the PMOS. We talk about PMOS when you go to your doctor, consult them. They will often give you either for few days they'll give you oral contraceptive pill, which has nowadays we have special treatment for the PMOS, which will reduce the androgen levels, which will reduce your excess hormones which are present into your body. Metformin, you must have heard of someone who is already taking these tablets, that is to decrease your insulin resistance. And sometimes we do give minoxidil, but this all depends upon your symptoms with which you are present. Do not do self-medication for this. Always refer to your doctor when it comes to medication. Can PMOS be cured? Like I said, there is no cure per se, that I give you a course of 3 months, 6 months, and you'll be cured of PMOS. That is not possible. But yes, it can be very well controlled, like I said, with proper exercise, good nutrition, and reduce your stress. Definitely, it can be very well controlled. And we have so many patients now, when we speak about this, often to them, we have these patients going off medicine. They don't need any medicine. They are going back to what their normal weight should be, what their normal BMI should be, and they have their periods coming absolutely regular. And they now are so thankful for doing all of this, to getting awareness, talking to them. Counseling is the most important thing when you are diagnosed of PMOS. Do not get scared. I'm telling you, do not get scared, because this has come like an epidemic nowadays. So every second girl, third girl is affected with PMOS, but there is no need to get scared. There are very good ways that we can control this PMOS. So what are the common myths is number one, eating sugar causes PMOS. Now, not exactly eating sugar, but what happens with every time you eat a sugary food, you eat sugar, you eat carbohydrate, the insulin spike is there. Insulin resistance will occur, and that's why the PMOS is. So only by eating sugar will not happen, but because it causes insulin resistance, it will cause the insulin spikes. We need to avoid the sugary food. Then again, marriage cures PMOS. It doesn't happen like that. Wow, what the marriage has to do with curing PMOS, but your proper exercise and the proper diet is going to. Pregnancy cures PMOS. Again, pregnancy is a condition where the hormone levels are almost zero when the pregnancy is there, and that's why some feel that, okay, PMO is cured. But once the girl goes back to, if she doesn't go with her proper routine, the earlier routine of exercise and diet, she may again develop PMOS. So it can happen that there was PMOS, a lady has become pregnant, after that again she has got PMOS. It can definitely happen. And we have so many success stories, where we share that with PMOS, the girls have conceived, the women, they have conceived, and they have wonderful their reproductive life. So few take-home messages before I just end, because I will give some time for the interaction also. If there are any questions, we can take them. PMOS nowadays is very common. Like I said, early diagnosis is very important. When we speak about other diseases, prevention for other diseases like hypertension, diabetes, nowadays the gynecologists, they speak often about the prevention of PMOS. And it is only possible that young girls, when they are at the age of 8 years, 9 years, 10 years, Start them with some or other physical activity, put them with some or other sports. That is very important. Right from beginning, if they are given proper exercise, their body is tuned to proper exercise, feed them properly. To all the mothers, if they are here in the room or they, whenever they listen to this, to all the mothers and the fathers at home, I'm telling you, do not give sugary foods or the junk foods to the children. Give them proper nutrition right from the childhood days, because what we feed them during their childhood is going to decide their diseases which will occur to them later on in their life. So it is very important for prevention. We just need to take proper care at the right age. It will not, if you don't take care of at the age of 8 year 9 year 10 years, when they are going to start their menses, later on they may immediately develop with PMOS. So till the 18 years of age, we generally do not call it as PMOS, or we do not do too much of scanning and all, but these are the precursors of PMOS. So it is not, we should not feel sorry that we knew about the PMOS, we knew about the prevention part, but we could not target at that time. We did not take care at that time. So to all the girls in here, it is not too late. Today is the day that when you start proper exercises. For anyone who has or who doesn't have a PMOS, everyone who is in a reproductive age, not in reproductive age, start with a good routine exercise today. Focus on your diet, take more of proteins, sleep properly, hydrate yourself very, very well, and good meditation or something which you can, reduce your stress. So every woman's PMOS journey is unique. There is no one like size fits all. Like I said, that's why it's called a syndrome. And the patients, they will present with different symptoms. With the right support, pregnancy, good health are absolutely possible. And you are not the alone. You are not the only person who will have PMOS. To all the girls, if they have been diagnosed, there are so many of them with you, and we are definitely working for a better outcome of all these PMOS. Thank you so much, everyone. This is the 3 takeaways from my side just before handing it over to the chairperson. Number 1, good exercise will prevent all the types of diseases, not only PMOS. Nutrition, focus on protein, then the fiber, and then the carbs. And good sleep, hydration, and no stress. These are the things which will prevent PMOS and control PMOS. I will not say cure, but definitely we can prevent and control the PMOS. So this was about the PCOS, which was earlier called. Now also, for some in some official pages, you will see PCOS word, but officially it has been now termed as PMOS. And this was the very gist about what I could have given you about the metabolic endocrine syndrome. So this was all about this. If there are any questions, you can put it in the chat box, and we can take, or if the chairman has decided to have it towards the end, we can do it similarly.
All right. Thank you very much, Dr. Swati Sarda, for sharing your valuable knowledge on insights on the PCOS and PMOS, a topic that is both relevant and important, especially for the young people who are becoming more aware of their health and well-being. So we now move on to the open discussion or the question and answer portion of the session. So this is now your opportunity to ask questions, clarify concepts, and gain deeper understanding of the topics discussed by Dr. Swati. We encourage everyone to participate actively and take advantage of this chance to learn directly from our speaker. If you have questions, so kindly you may use the raise hand feature or type your questions in the Zoom chat box. So we'll be happy to acknowledge you. So if you have questions, kindly type in now in the chat box. All right, anyone?
I think there is a hand raised.
All right, so we have a question from Director Meg from JCI. Please unmute your microphone lang po.
Hi, good afternoon. I have a question. I am diagnosed with PMOS, and I have experienced most of the symptoms. However, I am bleeding almost every day for the past 3 years, sometimes with blood clots. Is this something concerning?
Can you please repeat your question? Your voice was cracking.
Okay. Hello,
Director May, can you please repeat it again?
hello, can you hear me?
Yes, please. Go ahead. You said that you have been diagnosed as PMOS.
Okay.
Yeah.
Doc, I am diagnosed with PMOS and I have been experienced most of the symptoms. However, I am bleeding almost every day and sometimes with blood clots. Is this something concerning?
Yes, of course, we need to check on that. See, what happens is when we say that we give treatment is for with irregular periods when you are bleeding too much, because I said that there can be a variety of the symptoms can be very varied, right? From either you are not getting your menses to you are getting your menses in every 2 to 3 months, or you are getting your menses in 6 months. And if you are having frequent menses, like sometimes you can have in 7 days, 15 days, and some of them they bleed almost like daily, because what happens, like I said, that in there is an ovulation and the uterine lining. Like if I show you this, is this visible? Can you stop the screen share, please, so that this is visible? Yeah, so this is the uterus. You understand this? Now this is the uterus, and this is the dark pink line. This is called as endometrium. Now this endometrium is forming when you're not getting your menses. This keeps on increasing. When this keeps on increasing after few months, when you don't get your periods, it will increase to so much of size that it will keep on bleeding continuously. Director Meg, so this in such conditions, we need to give you some treatment to stop the bleeding, because you cannot keep on having the bleeding continuously. So definitely we give you certain medication to stop the bleeding and to have you have the regular periods.
All right. Thank you.
Yes.
All right. So thank you so much, Director Meg, and of course to Dr. Swati for that insight. So if you still have questions, you may just type it in the chat box. But due to the constraint of time, we have to proceed for now with our second session. All right. So we now proceed to the next part of our program. So we have already gained valuable insights from our first session. As we continue our journey of learning collaboration, we now move on to our second resource speaker this afternoon representing JCI Philippines. To formally introduce our next speaker, it is my pleasure to invite our project chairperson and 2026 director for internationalism of JCI Bacolod, Director Andrea Wellar. So without further ado, Director Andrea, the virtual floor is yours.
Thank, thank you, Director Nimrod. Um, good day, everyone, my JCI family. It is my distinct honor and privilege to introduce our esteemed speaker for today's session. Our speaker successfully passed the 2024 physician licensure examination, marking the beginning of a promising medical career dedicated to serving the community. Currently, she serves as a medical officer 3 at the Technological University of the Philippines, Visayas, a position held since 2024. In addition, she has been working as emergency room general practitioner at the Talisay City Primary Care Facility from 2024 to 2026, providing compassionate and timely care to patients in critical situations. Beyond the medical profession, she is an active and committed member of JCI Bacolod, having joined the organization in 2022, demonstrating a passion for leadership and service. She is a proud Gabay Batch 5 graduate and currently serves as a local skills development director for 2025 to 2026, helping develop future leaders and empower for fellow JCI members. Today, we have the privilege of learning from a physician who not only exemplifies excellence in healthcare, but also embodies the values of leadership, service, and lifelong learning. Ladies and gentlemen, please join me in giving a warm, enthusiastic welcome to our second speaker, Dr. Justine Mary Golingay. Thank you.
Good afternoon, everyone, and to my fellow JCs. Thank you for that introduction, Director. Can I share my screen now? Okay. Okay. So today we're gonna be discussing a topic that has become increasingly relevant, especially among teenagers and young adults, which is the effects or the dangers of smoking and vaping. Am I before we start or proceed, am I audible?
Yes, ma'am, you are audible.
Yes, Darren.
Okay, thank you. Okay. So let's continue. Anyway, many people believe that vaping is harmless or it is much safer than smoking, while others think that nicotine, which is a substance in vaping and cigarettes, isn't a big deal. So throughout this session, we'll separate those myths and facts and learn how nicotine affects our bodies while protecting our health, which starts with informed decisions, making us aware of the dangers of this smoking and vaping. Okay, before we start, let us answer this question. Which do you think is safe? The first picture or the second one? For those who think the first picture is safer, you may raise your hand. And for those who think this is safer, you may raise your hand. Oh, I see people raising their hands. Now, please raise your hand if you think neither of these are safe. Oh, no. So you think both of these are safe? Okay, okay. Again, there isn't a simple answer. While vaping generally exposes users for fewer toxic chemicals than the cigarettes, it is not harmless. Both carry significant health risks, especially because they both contain nicotine. Not just a cigarette, not just a vape, but both of them contain it. So for today's session, by the end of this session, participants will be able to differentiate the characteristic and health risks associated with smoke and vaping. We analyze how nicotine affects the brain, our cardiovascular system and respiratory system, and other parts, especially among adolescents and young adults, and to evaluate common myths and misconceptions about smoking and vaping, and to assess the short-term and long-term consequences of nicotine use and on individuals and public health. So first, what is smoking? So smoking involves burning tobacco and inhaling the smoke into the lungs. And the common products of this are cigarettes, which is the biggest picture here in an ashtray, cigars, pipes, and DIY or roll your own tobaccos. So when tobacco burns or the cigarettes burn, it releases over 7,000 chemicals, and at least 7 of these are known to cause cancer. And some of these chemicals include carbon monoxide, formaldehyde, benzene, arsenic, lead, ammonia, and tar. And I believe all of these are very familiar with us, and I know they are very toxic. So many people associate smoking only with lung cancer, but smoking actually damages nearly every organ in the body. Now, what is vaping? Vaping, unlike cigarettes, the vaping devices do not burn tobacco. However, they heat a liquid called an e-liquid or a vape juice to produce an aerosol. People actually mistakenly call this as water vapor, but it is not water vapor, it is aerosol. And this aerosol or the e-liquid contains nicotine, tiny particles, heavy metals, flavoring chemicals, and other substances like shown in the screen that users inhale into their lungs. Although vaping usually exposes users to fewer toxic chemicals than cigarette smoke, as I mentioned earlier, scientists and research have found that it is not safe, especially for young people. Why? So let us first define what is nicotine. Again, nicotine is a main addictive substance found in tobacco products and most vape liquids. After just one puff, the nicotine reaches brain in about 10 to 20 seconds, and it stimulates the release of dopamine, which we known as the feel-good chemical. So once this chemical has been released, it creates the feeling of pleasure and relaxation. However, it does not last long. It only lasts for a short time. So, of course, users would crave another puff. And over time, the brain begins to depend on the nicotine just to feel normal and to feel that pleasure and relaxation again. And that's how addiction develops. Here is a diagram to further break it down. Nicotine actually mimics a type of receptor in our brain to activate the dopamine. And once there's a release of dopamine, again, it creates a feeling of pleasure and relaxation. So of course, the more you use cigarettes or vape, the more receptors are being added into the brain. And of course, when there are more receptors, you need more cigarette or more vape or nicotine inside these products for you to feel that pleasure and relaxation again. So, of course, since there are more receptors, you need more cigarettes, you need more vape, and of course, when you feel that feeling again, it does not last long. So you're gonna vape again or you're gonna puff again, and the cycle continues. And its effects, again, since it only lasts for a short time, effects is temporary pleasure. It increases alertness, heart rate, and blood pressure. So to simplify it, the nicotine from tobacco products would enter your brain, and this causes the release of the pleasure-inducing chemicals, which is your dopamine. When the brain doesn't get enough nicotine, again, the pleasure-inducing chemicals aren't released. So there's no dopamine being released, and this leads to craving. This is to cravings and more tobacco use. Excuse me. And if you keep on using cigarettes and vape, eventually the brain would expect nicotine regularly. So when the nicotine levels drop, the withdrawal symptoms begin. And what are these withdrawal symptoms? Here are just some of the withdrawal symptoms of nicotine, which includes commonly irritability, anxiety, difficulties concentrating, restlessness, and strong cravings. Others, insomnia, headache, cigarette cravings, and fatigue, and sometimes depression. So instead of smoking, sometimes people would smoke to feel good because of the dopamine, you are relaxed, there's pleasure. Many people eventually smoke just to avoid feeling bad. And that's why quitting can be very difficult, but it is not impossible. So why is nicotine more harmful in young people? The human brain actually continues developing around age 25. So nicotine exposure during adolescence can interfere with normal brain development, and it can affect your learning, the attention. It reduces memory, increases anxiety, emotional control, and impulse control, and it increases the risk of addiction to other substances. Young people also become addicted much faster than adults. And there's research shows that teenagers who vape are also more likely to begin smoking cigarettes later. So if other people saying that they'll just vape to avoid using cigarettes, most commonly when you vape, eventually you'll be using both of these products. That's why prevention is especially important. So what are the health effects of smoking and vaping? Smoking can lead to serious health problems like damaging the lungs, increases heart diseases and heart attacks, and affecting breathing. And long-term smokers often suffer from chronic diseases like lung cancer, heart diseases, stroke, and respiratory problems. So the effects on uh, the lungs are one of the first organs affected. Of course, since smoking and vaping, you're inhaling these toxic substances. Over time, uh, the smoking damages the tiny air sacs or alveoli where oxygen exchange occurs. And this leads to chronic bronchitis, emphysema, chronic obstructive pulmonary disease, and lung cancer. Vaping can also damage the lung, and some users would actually develop chronic cough, wheezing, chest tightness, and inflammation. And there have been severe cases. There have been cases of severe lung injury associated with vaping, which is known as EVALE, or e-cigarette vaping associated lung injury. So for vaping, there's airway irritation, chronic cough, and reduced lung function, and EVALE. Again, healthy lungs are meant to breathe clean air, not smoke or aerosol. Aerosol is from the vape, and of course, smoke is from the cigarette. Those were the effects in the lungs. Now for the heart. Nicotine doesn't just affect the lungs, it also affects our cardiovascular system. How? It increases the heart rate, or making our heartbeat faster. It also increases blood pressure and causes our arteries to become narrow and blocked. Once these changes happen, it forces our heart to work harder. And over time, smoking greatly increases the risk of heart attack, stroke, and other cardiovascular diseases like your coronary artery disease. So it's not just smoking, but vaping can also increase heart rate, our blood pressure, and constrict our blood vessels. What's the effect of smoking and vaping on our appearance? Commonly, there's yellowing of the teeth, bad breath, premature aging, and skin damage. And smokers, again, often look older than their actual age, especially for chronic smokers. So I think we're familiar with the smoker's body because when you smoke, it affects not just the lungs, not just our heart, but also other organs. And it increases the risk of cancers involving the mouth, the throat, the bladder, the kidney, the pancreas, and the cervix. And it weakens our immune system, making infections more likely. So you're very susceptible for infections. It delays also wound healing and contributes to gum diseases and tooth loss. Basically, there is no organ that benefits from smoking. There's no organs, honestly. Now for secondhand smoke, the smoke is the smoke inhaled by people around smokers, even though you're not smoking, but around you are puffing anywhere and you inhaled those smoke. It is dangerous and it can cause health problems even for those who do not smoke, especially for children and pregnant women. And children who are exposed to secondhand smoke excuse me, have higher risk of asthma attacks and pneumonia. For adults especially those who are exposed for long periods of time, they have increased risk of cardiovascular diseases and respiratory diseases. And of course, that's why protecting others is another important reason not to smoke, and we should be considerate for other people because once you're smoking, it does not only affect you but also the people around you, your loved ones and your family. So let us debunk some facts and myths about vaping and smoke. Vaping only produces harmless vapor. Hans, what do you think this is? Is it myth or fact? Okay, as we've discussed a while ago, vaping, this is a myth. Since vaping produces chemicals and tiny particles, and it is not water vapor. Vape is harmless. This is easy. Of course, this is a myth, since the aerosol from the vape contains harmful chemicals as listed a while ago. Nicotine isn't addictive. Of course, this is a myth, since nicotine is one of the most addictive substances known worldwide, and young people can't become addicted. Of course, it's a myth, since young brains or adolescents and young people become addicted much faster. Nicotine can change how a teenager's brain develops. This is a fact, again, because young adolescents are affected easily and faster. Quitting smoking has health benefits even after years of smoking. This is definitely a fact. Why? Oh, which I will be explaining later. Now, why young people start smoking? This is usually due to, there are a lot of different reasons, but mostly it is due to curiosity. They are curious why a lot of people are doing it, why, and they want to know how it feels. So they try, and usually that one puff would lead to another and another. Sometimes it is influenced by friends and pressured by your peers, and others use nicotine or to cope with stress. Not only for work for the adults, but for adolescents during it is to cope with stress stress at school, or maybe we might not know, or family or financial aspect. Flavored vape products and social media advertisements also make vaping appear attractive, and and of course the statement, everyone is doing it, so why won't I? Unfortunately, what starts as an experimentation or curiosity can quickly become addiction. That's why at a young age we must educate them so that they are aware, and once they are aware, they can make healthy decisions. Why people should quit smoking? As I've said a while ago, for a fact, quitting smoking actually is beneficial regardless of when you started to quit, because the body starts healing almost immediately after quitting. Within 20 minutes, sorry, your heart rate begins to return to normal. It drops. Within 12 hours, carbon monoxide levels would decrease. Within weeks, your breathing would improve. You won't be having a hard time breathing. Within months, lung function gets better, and over several years, the risk of heart diseases, stroke, respiratory diseases, and cancer becomes lower. That's why, regardless of age, regardless of how long you've been smoking or vaping, it is never too late to quit. So for those who are planning to quit, or you know someone who wants to quit, here are just some practical steps. And honestly, the first step is that it has to be a decision you make for yourself, or a decision they made for themselves, because deciding to quit is already half the battle. And once you've decided to quit, you set a quit date. When you start to quit, you tell your family and friends. So for support, you identify your triggers and avoid them. Drink plenty of water to stay hydrated, and you stay physically fit, physically active, whatever works for you, may it be jogging, running, swimming. And of course, seek counseling or professional help from healthcare professionals if needed. And consider nicotine replacement therapy if it is advised by a healthcare professional, since this also increases success rate. Remember, don't feel bad if at your attempt to quit does not go well, since quitting often takes several attempts, and every attempt is a progress. The mere fact that you're deciding to quit and be healthy and taking care of your body is actually a lot of progress. So again, which do you think is safe between the two? After we have discussed those things, of course, it is neither. Although vaping can cause less toxic chemicals compared to cigarette, it does not mean it is safe to use. So, in conclusion, let's summarize what we have discussed. Nicotine is highly addictive, and smoking causes different kinds of cancer, heart diseases, lung diseases, and stroke. Vaping, it is not harmless just because it is contains less toxic chemicals compared to cigarette. Young brains are especially vulnerable to nicotine addiction, and quitting at any age greatly improves health regardless when you quit. So every healthy choice you make today affects your future. This may seem simple, but I'd like to end this session with this thought. Many people think smoking or vaping only affects the future. In reality, the effects begin immediately. And every cigarette you smoke and every vape puff exposes the body to substances it was never designed by God to inhale, or by a higher being to inhale. So the healthiest lungs breathe clean air. Whether you've never started, whether you're trying to quit, or whether you know someone who uses these substances, remember that knowledge is the first step toward healthier choices. Again, if you are aware, you make healthier choices. And also, thank you very much for your attention. These are my references. Thank you.
All right. Thank you so much, LSDD Justin, for your engaging and informative discussion on smoking and vaping. We appreciate the valuable insights you have shared, especially on the health risk associated with tobacco and vape use, and the importance, of course, of making informed choices for our well-being. So again, we will now open the open discussion and question and answer portion for our second speaker. So participants, again, if you have questions, you may use the chat box or you may use the raise hand button. All right. So do you have questions to our second speaker regarding the discussion on smoking and vaping? Ayan. So we have one question from JC Sarda, India. So what happened to body when you quit? So I think this question is directed to LSDD Justin. LSDD. So what happened to the body when you quit smoking?
Thank you for that question. Okay. Again, when you're what happens to your body when you start to quit? Again, the healing process of our body actually begins immediately, since after 20 minutes, your heart rate drops. When I say drop, it returns to the normal heart rate, since when you're using your vape or smoking, it elevates your heart rate. After 12 hours, carbon monoxide normalizes, and within weeks, your breathing actually improves. And within months, your lung function improves. And over the course of the years, the risk of developing heart diseases and cancer and respiratory diseases significantly decreases.
Right, so thank you so much, Doc Justin. And then I have noted here the question of JC Tanushri from India. The question is directed to Dr. Swati. Sometimes we experience symptoms, but when we get tested, the result comes back negative. In such cases, what should we do?
Yeah, like we shared in the PMOS session, that the PMOS is can occur because of the hormonal imbalance of any of the hormones, and it is not possible to check each and every hormone. So, what test has been done and what levels are there more than that. We need to see on the symptoms what problems you have. So, depending upon the problems and depending upon an ultrasonography, if they have diagnosed it as PMOS, then definitely it needs a rightful correction, just like we shared the lifestyle modification and the proper diet. So let us not depend only on the test, what the tests are saying, because if we have to diagnose PMOS, there are three things we need to check: whether the patient, what clinical symptoms they have, whether the patient has signs of hyperandrogenism, meaning the hirsutism, or the patient has acne, these symptoms, and third will be the lab test. So even an ultrasonography, the polycystic appearance. So any of the two are present, we call it as PMOS. So not necessary that the blood test will come positive every time. Even if they are negative, but you have the symptoms, then you should follow the treatment as advised by the doctor.
All right, so thank you, Dr. Swati. Do we have other questions from our participants? And so we have another question from JC. Sorry if I mispronounce your name. Vaibhav Fate. So from JCI India, how many cigarettes are good for a day? So the question is directed to LSDD Justin.
Thank you for that question. And again, the you rephrase your question, since the mere fact of using one puff of cigarette is not good already. So no matter how the amount of cigarette, it is not good to use in a day because of harmful effects.
All right, so thank you so much, Dr. Justin. Do we still have other questions? Again, so we have a follow-up question. So another one, JC Sarthak from India as well. Please tell me how to deal with cigarettes cravings.
Um, for these, uh, some will use mint gum actually to reduce the cigarette cravings, and constant counseling for your quitting journey is actually helpful. And of course, the support from your friends and family, because honestly, you can't do it on your own if you've decided to quit. But kudos to those who are already in that journey.
Thank you so much, Doc Justin. Then we have another question from JC Akansha from India. So can PCOS, I think this is PCOS affect mood, anxiety, and depression?
Yes, PCOS, PCOD, now we don't use this term PCOS or PMOS now. It does affect the mood, anxiety, and that is one of the major reasons why the girls, they are they go into depression, because of the body image, because of the inferiority complex, because of the weight gain, because of the acne, because of how they look. So definitely all these mood swings and anxiety are a part of PMOS also. And it is again because of the hormonal disturbance also. So what we said is the hormonal milieu is changing. So that's why there is some disturbance into the brain also, which can give rise to these anxiety disorders and mood changes.
Thank you, Dr. Swati. Then another question from Saurabh Urade. Please tell us about passive smoking. Doc Justin?
Passive smoke, thank you for that question. So passive smoking or secondhand smoking is just inhaling or breathing the smoke exhaled by a smoker or vapor. And of course, whatever they have inhaled as a secondhand smoker, you've also inhaled those toxic chemicals. So whatever affects the first-hand smoker also affects you, and it would increase your risk for cardiovascular diseases, respiratory diseases, and cancer.
Right. So then we have another question from JC Jigyasa. How to deal with period cravings?
The period cravings, they are because of the hormonal changes, especially because of the progesterone. When it starts increasing towards the menses. So you get period cravings or you get sugary cravings. It's very much normal. How to deal with it is with a smart choice. Now, suppose you have sugar, like you feel like eating sweet food, then you can go for some natural sweet fruits, like say dates or something like that. So these cravings can be replaced with smart food choices of the food. Go for the natural fruits, go for some fiber diet, which will help you overcome these cravings. But you can definitely once a while you can have dark chocolate. That is one of the things which is advisable, and you can, often you can help yourself with the cravings. Dark chocolate is a good form of one thing which helps you overcome the PMS also.
All right. So thank you, Dr. Swati. I think we're going down to our last two questions. So this one is from JC Pranay, India. Is there any safe level of cigarette smoking, or does even light smoking carry serious health risks?
Thank you for that question. There is absolutely no safe level of cigarette smoking, because even smoking just one cigarette can actually cause, or it carries serious health risks. And this is according, of course, to World Health Organizations and other medical organizations as well. And there is no such thing as what you call light smoking, because again, the mere fact of smoking one cigarette or vaping carry this serious health risk, as I've stated a while ago, which again would increase cardiovascular diseases because it increases, or it elevates your heart rate, it elevates your blood pressure, and it constricts your blood vessels. So once this happens, your heart is forced to work overtime, and the cycle continues. And of course, it increases risk for cancer and respiratory diseases.
Right. So thank you, Doc. Then I think this one is for Dr. Swati. Three questions. So first, lately I've been experiencing acne, delayed periods, and hair loss. The symptoms had been bothering me, and I'd like to discuss treatment options. From Sanskruti, India.
Yeah, I would like to share, Sanskriti. Let us discuss on a personal window regarding this, because I need further details about what exactly is your age, then depending upon what these symptoms are, since when long, how long, then what are the investigations which have been done or an ultrasonography done. Depending all of this, definitely we can, curate one treatment plan for you. But let us discuss. I'll put my number in the chat box. You can connect me anytime with for this.
Right. Then another question from JC Akansha. Can stress delay or affect periods?
Yes, it does. Definitely. Any form of stress. So now when we talk about PMOS, definitely stress is one of the factors. But even those who have regular periods, sometimes if you have had any exams or you have changed your place, there's a change of diet, you have been traveling, or there's some form of any physical stress or mental stress will affect your periods, the menses. So you may experience some disturbed periods for a month or two. So this is very much normal. Once, suppose if you have, then you get your menses regularly, then that is absolutely nothing to worry. But if you have constantly irregular periods, then you need to check with your gynec.
Right. So thank you, Doc. Then still about PMOS, is it okay to drink Coke Zero or Diet Coke?
Absolutely not. These are just the unhealthy choices. A big no to any diet zero or Coke. We do not advise. No sugar, no drinks. Even if they say that they don't contain sugar, but even then they are not advised.
All right. So thank you, Doc. Then let's proceed. I'll just cater the last two questions here from um, JC Rahul Sonole. So first, if someone quits smoking after 20 years, which organs can fully recover, and which ones sustain permanent damage? Second, can smoking permanently reduce lung capacity, or can it return to normal after quitting?
Okay, so when someone quits after more or less 20 years, their cardiovascular system actually can fully recover, dropping your heart attack and stroke risk to near non-smoker levels. It's like you didn't smoke at all. However, while lung function improves dramatically, organs like parts of the lung and your pancreas or your blood vessels would have structural changes that are sometimes considered permanent. For example, in the lungs, due to prolonged smoking, your tiny air sacs, or what we call alveoli, are destroyed and cannot regenerate. However, um, while these sacs are destroyed and cannot be replaced, the lining of the airway and the lungs and actually replenish themselves. And there are what we call hair-like cilia lining the airways that recover, which enables the lungs to clear up mucus or ward off infections. For the blood vessels, due to prolonged smoking, there is actually plaque buildup, and it would be more or less permanent. Although quitting would actually further stop their progression. And however, for the organs that would fully recover, again, it's your heart, your cardiovascular system, and some parts of the lung would actually recover.
Right, so we have one who raised up a virtual hand from JC Dr. Viru. Please unmute your microphone for the question.
Happy day to you all, madam. I could not hear the knowledge, but the session was very nice organized. So, how can I ask my patients to reduce the smoking habits? I could not on my video.
Thank you, sir. As professionals, we may guide them and explain to them what are the health benefits of quitting and the consequences if it continues. But again, the decision to quit is up to them. And the only thing that we as health professionals can do for them is to guide and to support and to encourage them to prioritize and invest in their health.
Okay, thank you. And another question for madam. How to prepare the young youths about their hygiene, madam? For ladies, like, so how to make them understand and tell them to make their hygiene?
Yeah. So are we talking about menstrual hygiene or hygiene?
Yeah, menstrual hygiene, and
For the menstrual
regularly they
hygiene?
get periods and all.
Yeah.
Yeah,
So
some people.
regarding,
Yeah. 1 minute, man. Sorry, my daughter used to use. I have two daughters. They use some cup or something, which is good or which is bad. I don't know about that. I did not hear the knowledge in between. I was in the traffic. Yes, ma'am. Yeah.
Yeah. So basically, today we spoke about PMOS. It is an endocrinological disorder in women. And
Yeah.
menstrual hygiene per se, it's a very large topic to share. There are so many things in that, which menstrual product, how to take care of these menstrual products. So there's a different whole session on this. But in a very short, I would like to say that the sustainable menstrual products which are available today are the menstrual cup. That's the best form of menstrual product which one can use. Even the girls can use, young girls can use it, and it is a sustainable product. It can be used for a very long time. One single product, if you buy, you can use it for a very long time. But if there are any menstrual product, be it a menstrual cup or a period panty or the tampons which are available, these are few options available. It has to be changed every 3 to 4 hourly, or if you're using a cup, you have to remove it, clean it every 3 to 4 hourly. So it should not happen that if there is no bleeding, you are not changing the product. It should not happen like that. It should be changed every 3 to 4 hourly. The hand hygiene is a must before using the product and after using the product. Hand hygiene is a must. And then disposal, like suppose menstrual cup, if you're using, you can use it like you can clean it and keep it after the use. And if there's a menstrual pad or a tampon, if you're using, then you must wrap it in a paper and dispose it off in a very safe place in a dustbin with a label on it, with a red dot on it. So then it is very easy for the the municipal corporation also to pick up these products separately. So these are the few things regarding the hand hygiene. Use of the product every 6 hours, 4 hours, 3 to 4 hours it should be changed whether there is bleeding or not. And smart choice of the menstrual product is a must, because nowadays we say no to a menstrual to a sanitary pad or to tampons because they are not reusable. So we are creating a lot of pollution because of these products. So the smart choices are the period panties and the menstrual cup.
Right, madam. Thank you. Thank you for your both doctors and who
Thank
are
you so much.
organized. Thank you. I could not see you because my face, I could not on my video. If anybody, I will just wish you people let go.
Thank
All
you.
right, so thank you so much, Dr. Viru,
Yeah,
for
yeah.
those questions. So I think we need to wrap up. The topics are really interesting. So I do understand that you still have a lot of questions to ask, but you may direct your questions later, or you may message directly to your officers. All right. So thank you to everyone for actively participating in our discussion and for thoughtful questions shared today. So we are grateful as well to our speakers, Dr. Justine, LSBB Dr. Justine Golingay, and of course, Dr. Swati Sarda, for helping us better understand the specific topics that you have shared with us, encouraging us to make healthier and more informed decisions. So let us once again give our speakers a warm virtual round of applause for generously sharing their time and expertise and valuable insights with us. As we conclude our learning sessions for today, we hope that the knowledge from gained from both discussions will inspire us to become advocates for health and wellness in our homes, schools, and communities. At this point, we shall proceed with the giving of certificates as a simple token of our appreciation and gratitude. They say that gratitude is one of the simplest yet most meaningful ways to recognize the efforts of the others. So today, we would like to express our sincere appreciation to the individuals in organizations who contributed to the success of this collaboration. So, for our recipients, certificate of recognition is presented to JC Dr. Swati Sarda, JCI National Trainer and Author, for being a valuable speaker during the International Knowledge Exchange session with JCI Nagpur Fortune and JCI Bacolod, empowering healthy lives, and for sharing expertise on women's health, PCOS, and PMOS that empowered participants to live healthier lives, given this fourth day of July 2026 via Zoom video communications, signed by 2026 President JCI Nagpur Fortune, JCI, sorry, my bad, Abhishek Tumsare, and JCI 2026 LO President Natalie Francia Igalvan. Another certificate of recognition is given to Dr. Justine Mary Golingay, MD, Certified Gabay Trainer and General Physician, for being a valuable speaker during the International Knowledge Exchange session with JCI Nagpur Fortune and JCI Bacolod, empowering healthy lives, and for sharing expertise on how smoking and vaping affects the body, that empowered participants to live healthier lives. Given this fourth day of July 2026 via Zoom, signed by 2026 President of JCI Nagpur Fortune, JCI Abhishek Tumsari, and 2026 LO President JCI Bacolod, Natalie Francia Igalban. We'd like as well to give the certificate of recognition to our co-host chapters, JCI Aklan Calantiao, JCI Antique Cruhay, JCI Mandaue, JCI Rojas Makawiwile, JCI Rojas Sinadia, and to our partner, our co-host organization, Alpha Phi Omega, and I, Nu Omega from NIR region. So let us give all our trainers and partner chapters a virtual round of applause for your support and commitment to this initiative. As we conclude today's collaboration training session, it is my honor to invite the 2026 Local Organization President of JCI Bacolod, Press Nathalie Francia Galban, to deliver the closing message.
Thank you so much, Director Nimrod. Okay. Right. Good afternoon again, everyone, especially to our speakers, all the leaders who came in today, and especially our co-hosts who have shared their afternoon with us. So as we close this international knowledge exchange session, my heart is actually full of gratitude today. We successfully bridged nations to prioritize our health, reminding ourselves that we must first be well to effectively serve our communities. So I would like to extend a massive congratulations to our incredible project chairpersons, VPOI Jigyasa and Director Don, who are both actually spearheading the internationalism for both chapters. You have made this afternoon really beautiful and very meaningful for both of chapters and our co-host chapters. I would also like to, of course, extend my thank you for bringing our two chapters together once again for another meaningful collaboration and for unwavering guidance and support. To my counterpart in JCI Nagpur Fortune, Press Abshik, IPP Prashant, and IPP Mark, thank you so much. And to my fellow Masari presidents who are here today, thank you so much for your incredible solidarity, especially from the Western Visayas, from JCI Rojas Makawiwili, Press Eliza, Press Jen, Press Lester, and Press Lord. Thank you so much. And of course, a profound thank you for a very inspiring and very knowledgeable afternoon to Dr. Swati and Dr. Justine for sharing your vital expertise on metabolic health and truths about smoking and vaping. You have equipped us actually with life-changing knowledge. And we could not have amplified this afternoon or without our co-host chapters, JCI Aklan Calantiao, led by Pres Jen, Antique Cruhay, Pres Lord, Mandaue, Pres Jess, JCI Rojas Makawiwili and Rojas Sinadia, by Pres Eliza and Pres Lester, and of course, my special guest from Alpha Phi Omega, Negros Island Administrative Region and Nu Omega, led by our Regional Director, Gideon Monte Alegre. Thank you for standing shoulder to shoulder with us this afternoon. And today's session is actually a beautiful kickstart of our International Human Duties Week. While we champion human rights, we must equally honor our human duties. And our very first duty as a leader is self-care. So we simply cannot pour from an empty cup. So by choosing healthy habits and understanding our bodies, we fulfill our duty to live a purposeful life, allowing us to more effectively empower others, of course. And I'll also take this opportunity to invite everyone. Our international fellowship doesn't stop from Zoom. And I am thrilled to invite you all to the JCI World Congress, WorldCon 2026, happening here in Philippines, Clark, Pampanga, on November 2026. Let's bring this incredible global energy and cross-border synergy to the grandest stage. Thank you, everyone. Let's keep moving forward. Let's forge tighter bonds and achieve more together. Namaste and mabuhay to everyone.
Thank you very
Maybe,
much,
yes.
Press
Thank you.
Nathalie, for that inspiring and meaningful closing message. And to give us an idea on what will happen to the WorldCon, um, let us watch this video. Ayan, so JCI 2026 World Congress in Clark, Pampanga this coming November 11 to 15, 2026. So see you all there. All right, so before we officially end, the attendance form is actually sent in the chat box, or also you can scan the QR code. But after signing in, please don't leave because we will still have our photo up. So kindly scan for a while our QR code, or you may access it in our Zoom chat box. All right, so we'd love to capture this special moment. So may request everyone to kindly turn on your cameras for our virtual group photo. Ayan, so others, please turn on your cameras and show us your beautiful smiles from where you are right now.
Okay, and I think I'll just do the screenshot.
Thank you, Press.
We're on our first page. We have, I think, 3 pages. So please bear with me. Just a sec. Okay, I'm on page 2. Okay, just hold one more, just a second. All right, we're on our last page. Thank you so much, everyone.
So today was more than just a training session. It was a celebration of international friendship, collaboration, and shared leadership. Thank you to our partners from JCI Nagpur Fortune, our co-host chapters, trainers, speakers, as officers, and participants for making this collaboration possible. So may the connections we built today continue to inspire future projects, partnerships, and opportunities for positive change. So once again, this has been your host, Director Nimrod. Thank you for spending your time this afternoon with us. Vamos, Western Visayas. Mabuhay ang JCI Philippines. Mabuhay ang JCI India. Together, we create positive change.
Thank you so
Congratulations,
much,
everyone.
everyone.
Thank you so
Prashant and
much.
Dr. Swati, thank you so much.
Thank you so much,
And
Thank you
everyone.
so much.
as well as to our co-host,
Have a
Chapter.
great time. Bye. Thank you.
Congratulations, everyone.
Congratulations, Dr. Jigs at JC Jigsaya, and of course, Director Don. Congratulations.
Thank you so much. Congratulations.
Thank you. Congratulations.
To our co-host chapters, thank you so much.
Thank you very much. Congratulations. More power to you all.
Thank you so much. Good job, everyone. We were at 89 full swing earlier.
దీనిలో పేరు ఉందా పేరు కూడా కడిగేసి అట్లా
89 participants today, but we closed off at 55. Good numbers still. You can already jump off the Zoom room where our session is done for today. Thank you so much, everyone. Don't forget to fill out the attendance form. I have also shared it with VP Jigsaya. You can share it if you were not able to capture it earlier. Thank you to JCI Ross, Sinadja, and JCI Ross Makawiwili for staying and for joining us today. Also to our 2024 past president and area awards chairperson, Pres Joseph, thank you so much. And of course, Pres Prashant, thank you so much for your support and guidance together with Pres Mark. Thank you so much. All right. I think there are still a few who are here. We'll just have a quick evaluation after, just very quick. All right. So are the core team, I think there are still a few. You may already jump off. Okay, so we'll end the call for now, and then let's jump back in for the evaluation, so that the rest of the participants who don't need to be joining the evaluation will be off already. So let's join back after a minute or two. Thank you so much.
Yes, ma'am. Thank you so much. We will be joining in few minutes. Again.
Yes, thank you. All right. Okay.
Thank you.